Welcome back to Connect for Health. It's the live webinar and podcast series brought to you in collaboration with Mental and Cigna Healthcare. And this is the show that gives you the information to live a more empowered life when it comes to your health. I'm Scott Armstrong. I'm the founder of Mental, a platform that aims to tackle the stigma of mental health and promote well-being wherever it may be. And once again, I'm joined by my fabulous co-host, Maissa Khafajy, the head of government affairs and strategic communications at Cigna Healthcare. Brilliant to be back together, Maissa.
Always. Thank you, Scott.
Now, today's episode is very well timed, particularly if you're a parent. It's all about keeping flu at bay and the immunity boosting actions that we could take. It sometimes seems counterintuitive that with the sunshine that we're all living in, that we could be struggling with flu. But believe me, I think any parent whose child has gone back to school would tell you different. And now, remember, today's podcast, we want you to get involved. The webinar, this is for you. So if you have questions for our guests today or for us, please put them in the chat box. Now, if you're watching on catch up on YouTube or on the podcast channels, you won't be able to take part in that interaction. If you want to be with us live next time around, please reach out to Cigna Healthcare for membership details. Now, my guest today, I'm delighted to welcome Dr. Rania Ayat Hawayek, who is the founder and medical director of Circle Care Clinic. Dr. Rania, welcome to Connect for Health.
Thank you for having me.
Right. First question. And I'll come back to what I was saying, that kind of counterintuitive with all the sunshine that we're still living with in this region. It sometimes feels that it can't be flu season yet. But is that a myth? And also, how prepared, how seriously should we actually be taking flu at this point in the year?
So very seriously would be the answer to your last question. It is a little bit of a myth living here when you have a large expat population and or the population as a whole travels a lot in the summer. You do get lots of people bringing back viruses. So as soon as school season starts, you do get a surge of these viruses. It's always in the clinic. We always brace ourselves the first week or two of school. Yeah. It's quiet and then it surges, and many people do travel to areas that are quite cold. So like Southern Hemisphere, where it's winter when it's our summer, and then you have the influenza season there starting earlier than with us, so they bring those back. So we do see surges after holidays, interestingly here. So yes, the weather is no longer a sort of a guide as to when flu season starts.
In general, when should we be kind of prepared? I mean, it's interesting. Right now, my daughter's off school. She's had the temperature, and it's not influenza, but she's had the temperature. Yeah. She's had the blocked nose. Yeah. We've got her off school. I know parents as well of children who have been in hospital with influenza already, which it almost seems like, was this too early? But when is? I mean, is it now? Is it that?
It is now. It is now. I mean, I remember last year we had the flu vaccines. Influenza vaccines coming in mid-August, and we started sort of dishing them out just before school started. They've come in slightly later this year. We're just receiving them now, and we're beginning to see the first. So now would be the time to prepare on all fronts, whether it's vaccination, immunity boosting, all of the things that we're going to talk about.
So without over-egging the fear factor, how important is it for us? Because obviously 100 years ago, influenza was a big deal.
Absolutely.
Now we have the benefit of vaccination and we have the benefit of much greater healthcare. Yeah. But how seriously should we take influenza, both as adults and as parents of young children?
Yeah. So I would say fairly seriously, but let's think of why. So so I'm a pediatrician. So if you have a child with something like the tendency for asthmatic symptoms, or a child who was born prematurely, or a child with other medical issues, then I would say take influenza very seriously. Yeah. It is a virus, and by definition, our bodies can fight off viruses on their own. But influenza wreaks havoc with the immune system and is unique in that its duration of illness is far longer than other viruses, whereby other viruses have a life cycle of around 7 days. With influenza, it's around 10 to 14 days, with much higher fevers, much worse symptoms, prolonged period of reduced appetite, etc. So what happens during that time is the immune system does take a major hit. And in my mind, it's not just influenza itself. It's actually the weeks and months after influenza, which do then go into our winter season. And we begin to see those same children coming back with back-to-back viruses.
Right.
So I think it's not just influenza. So even,
Yeah.
so I have so many patients who say, no, we don't want the vaccine, or there is a medication to treat influenza if you were to diagnose it in a timely fashion, you know, and no, we don't want the medication. We want to fight it on our own. And then I find those children are the ones that struggle throughout the winter season, actually.
And you keep seeing them in the clinics.
Absolutely,
So you
for
kind of-
other reasons, exactly.
So you touched on something that
Yeah.
I actually wanted to really wonder and perhaps maybe clear the air about. What do you feel is like a misconception or a misunderstanding that maybe the general public have of the flu vaccine? And within your experience in the clinic, what did you sense was, for the most part, the reasoning behind why a lot of people didn't want to take it?
So several reasons. So you have your typical, parent or patient who doesn't want the extra vaccines because, in a sense, either they're worried about an extra visit where a child finds it traumatic because it's an injection. This season we will have the nasal flu vaccine, so that sort of covers that slightly, which is a very new thing. But then you also have parents who believe that taking the flu vaccine weakens the immune system. This is the biggest myth of all, actually. So
Okay.
vaccination, in essence, helps presents an illness, whether it's a virus, and there are some vaccines for some bacteria, to the body in a way that is safe, allowing the body to practice and build an army of antibodies against that illness, so that when you are faced with the actual illness, you either don't get a clinical response that's visible at all, or you fight it subclinically without getting the symptoms. So in essence, it strengthens your immune system. It doesn't weaken it, and I think that's the message. And for most people, I feel, if they've gone through the pain of influenza, they come running in for the vaccine the next season because they realize, and even if their child wasn't unwell enough, or if they were not unwell enough to need the hospital care, but it's the days off school, it's the days off work. It's actually the logistical nightmare around being unwell, and it's the domino effect you get within the household.
So
It's highly contagious.
can I just ask, I know that usually with most vaccines, people will always ask things like, okay, what am I likely to expect when I have the vaccine? What would be side effects? I wouldn't say side effects per se,
but
but
side effects.
what are the symptoms?
My common misconception would be that as soon
It
as I've
gives you the
taken
flu.
it, I'm going to get a milder version of the flu.
So it depends which vaccine. So if you are going to go for the one that's most commonly known, the injectable influenza vaccine, that's an inactivated vaccine. That doesn't actually give you symptoms. You may get a little bit of higher temperature that day because there is an immune response. You will get a sore arm because that's a local response to any injection going into your muscle there. But if you are, so with the nasal flu vaccine that's available this season as well, that is a live attenuated vaccine, and there is an expectation of some nasal congestion, but never outright influenza. So I think, yes, there is a misconception about many vaccines, and the influenza vaccine does not give you the flu. And I get this, but I got it last year and I felt sick so often. And I always say, maybe it was the time you visited a clinic to get the vaccine was high season and you probably caught something there. And that is actually something to think about.
I need you to, and I'm sorry to all the gentlemen on the webinar today, I need you to kind of bust another myth for us, or just talk us through, because I have actually had influenza, so I know what influenza feels like. But we often joke about man flu, and even right now, which I'm told can be fatal. However, even right now, my daughter's off school. She's running a high temperature. She feels grotty. She's all bunged up. That's not influenza. And if you've actually had influenza versus, you know the difference. But talk us through that difference. What are those major symptoms of influenza and the early signs, so that both we and parents can understand this could be influenza, as opposed to
the regular, the common cold.
The common cold,
and not play it down.
Exactly.
Yeah, so it's difficult early on to tell the difference, but influenza does give you more systemic symptoms as compared to the common cold. So where the common cold would be a little bit of a scratchy throat, a runny nose, maybe a bit of a temperature, but it almost sits up here around your head and neck, and you may get a little bit in the way of fatigue. But with influenza comes the actual muscle inflammation. That's where the body aches come from. You actually get chemical, like biochemical breakdown of muscle fibers, and that's one of the biggest sort of complications of influenza, where children have to be carried and picked up. So if your child is running a super high temperature that you're struggling to control with the regular anti-fever medications, and your child actually needs to be carried to walk. I mean, children, we know, we have kids, and you give them a little bit of paracetamol and they're running, bouncing up the stairs, etc. So with influenza, they are miserable. So there are different types. There's influenza A and B. A tends to be more like a cold, and B tends to, this is generalizing slightly, but tends to be more of a drier in the nose illness and affects the gut more, with more sort of abdominal pain and maybe sometimes diarrhea. So can get confused with stomach viruses. But on the whole, it's higher temperatures, it's headaches. Children hardly ever complain of headaches. And even with us, we hardly get headaches related to cold. And it's the severe body aches. And it's the very quick progression of symptoms, actually, within 24 to 48 hours. So I think in the seasons, and if you hear on a class group chat or with friends or colleagues at work that someone has influenza and you get symptoms, think in your mind, influenza unless proven otherwise, get tested, and so that you can jump in with medication if you were to choose to do that.
What's the ratio? Is A more common than B, or do we just get a...
Yes. A tends to be more common than B. So you would look at a lot of the vaccinations, the ones that have 3 strains, they normally have only 3 A's or 2 A's and a B, and the ones that have 4 strains will always have 3 A's to a B, depending on, they always study the sort of trend prior to putting the vaccination together. And that's why it's a seasonal vaccine. It does change in its components season to season.
So here's my question to you. So my son, my teenage son, had influenza B last year, and he had it was just a series of things. And with what you said, so he does have mild asthma. He has allergies. He developed bronchitis, and then about a month or so later, he had influenza B. And at the time, once he had the confirmation, they gave him, I think it was Tamiflu.
Yeah, absolutely.
But had he had the flu vaccine,
he may well have been protected. Even if it was a B strain not covered by the vaccine, you do get the cross protection because they are similar genetically, let's say, they are similar in structure. So so he may have still been sick, but maybe not as sick. Exactly.
Because I'm thinking of prevention now, because he hasn't had the flu vaccine and it's an important year for him.
So for your son, he would be prime candidate to getting the vaccine before.
See,
there you go.
I can see we've got questions already coming in. Don't worry, we will get to them. I just want to clear up one other thing. So no truth to the rumour that we can catch influenza from the school WhatsApp group.
Yeah, you can't. No. You can catch other things from that group, not influenza. Quite a few headaches, but not influenza.
But it does actually set me up for another question I wanted to ask, which is, and it always seems like, if my daughter picks up anything from school, she spends a few days kind of incubating it, and then it gives it to us, and we feel 10 times worse. But what is the kind of child's experience of influenza versus the adult experience?
Versus the adults. So it's a very good question. So children tend to be more resilient. They bounce back quicker. They have younger, more robust immune systems, and they're sort of exposed to very similar viruses all on a daily basis. So what people don't understand is you don't only get sick when you're exposed. You are exposed to a virus every day, and your body actually fights it subclinically all the time. You inhale it through your nose and you get surface immunity that fights it there. If it gets to your throat, it fights it there. If it gets into your bloodstream. And only when your immune system loses that initial battle do you then get sick with it. So you're constantly making antibodies against viruses, even if you're not sick with the symptoms. So with children, think of their high level of exposure. They're all picking their noses, putting their hands in their mouth. There's always this touching of the surface.
Isn't
the
it beautiful to be parents?
Lovely, yeah. And that's why it sort of drops a bit when the older ones don't do that so much, actually.
Yeah.
Okay.
But because of
interesting
that,
to note.
it's true, yeah. But because of that, you find these, under 4 or 5 year olds are exposed. But when they do catch an illness, they bounce back quicker.
Yeah.
Whereas with us, if we were exposed to those viruses 20, 30 years in our past,
Yeah.
our immune system isn't then as as robust, and it's not as good as fighting because we're aging. So it's not as good as fighting back. So yes, man flu is a topic of conversation, and this is something that
I'm going to
that is
revisit this
observed.
before we finish this webinar.
And
I
it's
promise
so funny,
you this.
by the way, it's so funny. In my office, I always say boys also tend to be burdened more with their symptoms generally
That's my son.
than girls. even my pediatric patients. And it's
Yeah.
and I always wonder, it's for another conversation
sure.
perhaps.
Wow,
This is anecdotal. This is not research based. Yeah, this is
Okay, right.
anecdotal.
I think we definitely really want to come back on that.
Scientifically
I mean, yeah, if we can clinically prove that man flu is definitely a thing, I think I'll be a champion among husbands everywhere. Right, it's time for our first poll of the day. Now, in a second, you'll see the questions pop up on your screen. We want to know how you prepare for flu season. So the options are: I get my flu vaccine. Well done if you do. I focus on healthy lifestyle habits, diet, sleep, hydration, and we're going to talk about those in a moment too. I don't usually do anything specific. I think I might be guilty or not sure. Interesting one. So you've got a couple of seconds. Please vote. Let us know what you do. Anecdotally, or just from your experience treating patients in the clinic, where do you think this is going to come out? Are people getting their flu vaccines, or just people leave it and don't do anything specific, and then they're coming to be treated as opposed to looking for prevention? Where's that balance?
I find that parents, once they've had children go through school, do tend to take their flu vaccine more because they've experienced it firsthand. And I find that the younger adults who nothing phases them, tend to not. So in my experience over the last, I would say, decade, more and more people do take the flu vaccine. It's either that or I do nothing. I think you'll find those are the two.
Maissa,
Actually,
while we're waiting, while people are still voting.
So I hand on heart, I've never had the flu vaccine. My children haven't, but that's going to change after today. But what I do is I'm always looking at things that I'm consuming. So I'm always looking at, lemon and ginger. I like having my hot drinks. But I've also, I think it's been about a year and a half, I take colostrum. And I've actually found that it has
great immune boosting.
It has great immune properties, immune boosting properties. And the only time I felt that was challenged was when I had traveled to Umrah, came back, and I had COVID. But otherwise, it was
because
brilliant.
can you imagine the onslaught of just the viral load you were in highly sort of populous situations that happen.
Absolutely. Yeah.
So I'm going to get you to guess. What percentage of people do you think don't do anything at all?
Over 50.
Yeah, I'd
Over
say
50?
a considerable
60,
amount.
no?
You're actually, we've got to, this is Health for Connect, and we're now 5 episodes in.
Yes,
So we've got a very informed audience.
Good.
Well done.
So maybe
we're
yes,
slightly
yes,
underneath, but
okay.
no, 42.9% don't do anything specific.
Right.
And only 1/5 of people, 21.4%, getting their flu vaccine.
Skewed
And then-
population, skewed
Very
listeners.
much, yes,
1/3 of people, 33%, saying they focus on healthy lifestyle habits, diet, sleep, hydration. Maissa was just talking about the lemon and ginger there. How much of a difference can that make? How much can we boost our systems? And am I guessing that actually that's great, but it's still not, it's still...
Yes.
How do you optimize? Yes.
So I think it can make all the difference.
Yeah.
I don't think we can say it can stop you from catching influenza, but I do think it does improve your bounce back. It improves it shortens your recovery period, maybe improves the severity of symptoms. And I think going back to basic principles, and people love the idea of what is the magic supplement, what is this?
Yes.
Because this is easy to just add to your daily life. But what's more difficult for people is sleeping well. That seems to be very difficult for people.
Yes.
And eating better or avoiding the things in the diet that sort of cancel out all the good stuff. Okay.
Yes, yeah.
And I find that people would love to just continue with their lifestyle, sleeping 5 hours a day and getting a sleep debt, and partying, doing all the things that sort of wear down the body, not eating as well, skipping meals, etc. Because we all have busy lives, and then taking a magic supplement. And I think that people need to understand you really need to go back to basic principles. And as a pediatrician and as a mum, I cannot stress enough hours of sleep, especially in the wake of summer when all that goes out the window for many children,
for many,
especially the teenagers.
Yeah.
I cannot stress, despite what they tell you, teenager needs 9 to 11 hours, and it's near impossible getting it with traffic and activities and. So,
and the start of school times.
Yeah, absolutely.
Yeah, it's just
but there's nothing like sleep. Improving vitamin C containing foods. So that is known definitively to improve our ability to fight things. Yeah.
I've started eating kiwis with the skin on.
But that's very good. Also for fiber, actually, very good. That's excellent.
That was
another thing.
Haven't tried that yet, but then I've heard.
I need to bring the. And I did say I'll get some questions. Simon, thank you for getting involved, Simon. And actually, before Simon, Anthony, absolutely, man flu is a real thing. Absolutely, I've got you. But no, Simon has come on and says, does honey, ginger, garlic, cinnamon and propolis, is it propolis?
Propolis, which is like
really help boost immunity and consequently stave off the flu?
So there is some research based on this, but there's also a lot of anecdotal evidence. So there is. So when it comes to honey or manuka honey and those honeys, that is probably one of the very few dietary components that does have research evidence-based to improve immunity. And what it can do, rather than sort of protect you from catching something, is help that subclinical fight that happens prior to your getting the symptoms and maybe minimize your symptoms. So, and once you've caught something, honey does have, it's the surface properties on your actual, if you could go in and smear honey on a throat that's inflamed, we do know that honey, even way beyond, way before modern medicine, was used to help with wounds and stave off, local bacterial infections. And even to this very day in Eastern medicine, it's used as a base in lots of balms and things. So yes, and then ginger, turmeric, all those things. There is anecdotal evidence, I want to say, that yes, it does help you fight it.
Right. Yes.
On the honey, should people be having that every day then? Is that something that, where would that...
I mean, good question. I mean, I tend to recommend teaspoons of honey as an alternative to cough syrups to my patients.
Right.
So just to keep in mind for listeners that infants under the age of 1 are not allowed to have honey because there's always the risk of botulism with that. But it sometimes works better than a lot of the cough syrups available on the market. But the thing about honey, it's not about you swallowing it and it going to your stomach. It's actually what I said. It's like a lozenge
on the top.
It's actually, so I always tell parents, you can give it to them, but don't have them drink water immediately afterwards. Wait a few minutes because that's the benefit that it's literally the benefit is to that tickly cough or the throat more than anything.
I feel like I should give some time to all these questions as well. Thank you again for. We love the fact that you get involved. So, Minu, you ask, what is the relationship between asthma or an allergic condition and flu as a virus condition? Do kids who continuously sneeze every morning, are they more prone to flu, or is it just an asthmatic allergic condition?
Yeah. So good. So they may be more prone to flu because they have a more active sort of nasal mucosa. So the ones who sneeze in the morning, they may have an element of what we call allergic rhinitis, or in layman's terms, hay fever or seasonal allergies. So you do have a more active nasal mucosa, which then has more inflammatory cells on the surface that are more active. So if a virus was to fall on that, your nasal mucosa is almost more open to it. But more importantly, especially with children with a background of airway hyperactivity or asthma, if they were to catch a virus such as the flu, they're more likely to have an exacerbation of their asthma. So because the flu is a heavier virus than other, and when I say flu, I mean influenza, is a heavier virus than other viruses. I mean, there's also para-influenzas, lots of other, if that did cause a respiratory response, then that child is more likely to have more severe asthmatic reaction and need their medications for a more prolonged period of time, have more days off school, affect their, sports performance, all of that, which then increases the risk of pneumonias, increases the risk of hospital admissions. So there's lots on the back end of that.
I wanted to ask, and sorry, I feel like I'm
No,
hogging the mic a bit.
of course not.
And it's only from a personal experience,
Yeah.
which is actually about 6 weeks, about 2 months ago, I actually got pneumonia and was in hospital.
Yeah.
Thankfully, it was very, very small, quite painful, but I recovered fully from it. But who are the at-risk groups then? Who really should be leaning in and listening to the advice and thinking, I need the flu vaccine or I should get it because of X, Y, or Z?
Yeah. So I would say, anyone immunocompromised, because by definition, whether you're an adult, child, that increases your risk of catching any infections. So you would go for the inactivated injectable flu vaccine, which would not then affect you.
Okay.
Pregnant women,
Okay.
very high up on the list, because again, getting a very high fever type of illness during pregnancy can be very, very dangerous for the fetus and for the mum.
Right.
The elderly, because again, they're weak. And then infants, the influenza vaccines licensed from use from 6 months old for good reason. And obviously within the pediatric population, any child with a chronic illness, especially if it's a respiratory or cardiac illness, any child who was born prematurely because we know that they were born with weaker lungs and perhaps needed, any child who had an NICU, a neonatal ICU stay, actually, is there. And for me as well, any parent who's about to have a newborn baby, any parent who travels a lot. So sometimes you're taking the influenza vaccine or you being at risk. It's not just about you, it's you passing it on. So if you are the sort of the vector because of your lifestyle, because you're always on an airplane, you're always, then that person should think of who do they have at home? Do you have an elderly parent living with you at home? Do you have someone visiting over Christmas who could be at risk? Do you have a newborn coming in? So it's all those things actually.
Can I just ask, how often do you see, maybe not necessarily in your clinic, but, pregnant women who actually do take the flu vaccine? Because there's always this paranoia about, I want to minimize, because I remember back in the day when I used to, kind of like counsel patients and stuff, there would be a case of, I don't even want to take paracetamol.
Yeah.
And it's safe to take paracetamol, but they wouldn't want to. So what about a vaccine?
So that all depends on, I think, your gynecologist or obstetricians.
Right.
And so if a woman is in her third trimester, in the run-up to influenza season or during influenza season, I mean, it's safe throughout pregnancy anyway, but then it all depends on the obstetrician. So now we know there's the DTaP vaccine that is recommended in the third trimester of pregnancy, completely to protect the baby for the first 2 months before they start getting the regular vaccinations against tetanus, diphtheria, and whooping cough. And the influenza vaccine is one that's offered, but not by all obstetricians. So I think I was having this conversation with a patient just yesterday who came to see me before her baby was born. And I know the obstetrician, and I asked, what vaccines have you been given? And she said, DTaP. And I said, but there's the RSV vaccine that can be given to pregnant women and the flu vaccine now. Go back and ask him, or shall I call him for you? So I've in our clinic, because we do more than just pediatrics, family medicine, very often I will have a mum with a 3-year-old and she's pregnant. And while I'm done examining the 3-year-old, I'll say, have you had your flu vaccine? Please pop in and take it if you haven't for these reasons. So maybe not as many as they should is the answer to your question. Not as many as should.
Can I just want to jump in, which is a very unplanned question, but just so we've said it as well. Right now, because of the social media age that we live in, and I won't say where it's stemming from, but there is a narrative that's being put out there. When people are thinking about vaccines, sometimes people will hesitate because they are being fed misinformation or they're not getting their information from informed and also impartial sources. So how do you allay, 'cause I imagine there must be some concerns when patients come to you going, vaccines.
Yeah.
What is it you say to patients to allay their concerns?
Yeah, I mean, it's an excellent question. It happens every day. And what I always say is, please go and read about the disease you're trying to protect against.
Yes. Right.
So very often people get so it's almost like this tunnel vision looking at the potential hazards of a vaccine and the components within a vaccine that might increase the risk of X, Y, Z.
Yeah.
A lot of it is sort of, there is research on it, but the research isn't sound. They call it research, but God knows, if you were to look at the study, components, or it wouldn't actually tick the box for sound research.
Even who's funded it.
And controversial news is always louder. And that's the issue.
Yeah.
And so I always say, please go and read up on measles, read up on mumps, read up on influenza and what it might cause.
Yeah.
And then, come and think of the vaccine. And there's always this concept of, big pharma and conspiracies. And the truth of the matter is, it is probably more lucrative for the healthcare, if we're just going to talk economics, more lucrative for the healthcare industry to just have people fall sick.
And then treat rather than
actually, rather than give these vaccinations. But people just actually don't think like that.
Yeah.
So I would say, always educate yourself equally, at least equally. You owe that to yourself about the disease itself and what the potential complications are, and not just what you believe are hazards related to the vaccine.
We kind of come back to where we were talking earlier about how big a deal is influenza. And if you were to go back a century ago, they would be saying, please give us the influenza vaccine.
Yes, because that's the other thing, actually. Yeah, good point. I always tell people, because this is one that's a very common conversation about the MMR vaccine for obvious reasons.
Gosh, yes.
And I always say, you know what, you and the parents in my office range from ages between 25 and 45, let's say, and I say, you've never seen a case of measles. I was trained in the UK. I've only seen one case of measles.
Yeah.
I have colleagues who were trained in South Africa who took to giving the measles vaccine to every child who came through the emergency department, even if they were there the day before, because they couldn't keep track, just because they saw so much measles. So when you haven't seen the disease, whereas if this age group were to talk to their parents or their grandparents, if they're still around, those people have actually lost siblings to measles.
Yes.
And the impact of the disease is lost when vaccination programs have been so successful, but we haven't eradicated these illnesses, especially in the wake of COVID.
Yeah.
There's a surge.
It's also kind of like, if you've had influenza,
you would
know.
Yes.
And
absolutely.
I remember, and I think I was 17 when I had it, and I remember just not being able to move.
It's like being hit by a bus.
Exactly. Interesting question here from Rasha. When do you think someone should actually, because we do, and it is that man flu thing, it's just man flu, and it's just flu. Well, when we say flu, we're not actually talking about influenza. We're talking about a heavy cold with the fever, feeling really grotty.
Yeah.
But at what point should we actually stop saying it's just the flu or it's man flu and actually go and see a doctor?
If you can't get out of bed.
Right.
Not just if you think you can't get out of bed, if you actually cannot.
Yeah.
I think it's the body aches for me. So if you have a cough that you really feel is painful if you've had a cough long enough that your chest wall hurts, I think you should get checked to check that it isn't a pneumonia. And if you have muscle aches that are so bad that you can't get out of bed, if you're feeling dehydrated, you haven't passed urine for several hours, all of those things, I think they're red flags. And it's just the flu, but as you rightly said a while ago, we live in a time where medical care is excellent. We all have access to excellent medical care.
Yeah.
Why not shorten the duration, and why not improve the severity of the symptoms and up and about sooner?
Yeah.
I'm going to tag in our audience again. So we've got two kind of questions. Mina is asking a question about how periodically should the flu vaccine be taken once a year. Thank you for that. And we also had another question earlier, which was for someone who is saying wanting to travel and they still want the vaccine to be effective, say in March. So again, it's that kind of, what's the timing period?
So we noticed that the protection from the injectable vaccine tends to last for maybe up to 6 months. But but because especially here we tend to start giving it quite early in the season. We do find that those patients who get the flu vaccine tend to never visit us with influenza during the winter season, but then come February, March, and there's the season here interestingly spread. Absolutely, and spring break travel, exactly. So they then start falling ill. So ideally, the influenza vaccine being taken mid to end October should carry you through well and cover the majority of the winter season.
Okay.
But then you are then at risk earlier. So, which is why I'm so excited about the nasal flu vaccine coming in, which can be given from 2 years to 49 years old. I'm just in there. And
That's me gone.
the immunity from that lasts longer because of the way it works.
Right.
Okay.
So
there's an
yeah,
interesting
yeah,
one for you
yeah.
then.
I'm trying to think about the delivery system. So what is it? Is it
It's
just
a nasal
kind of-
spray,
And
so
it's-
it comes in one. It's a fantastic. So
Yeah.
this is a vaccination that's been given in the UK for
Yes.
years, and in North America for up to 2 decades, and it is why they can deliver so much influenza vaccine so easily in the schools because it's not
Right.
invasive and it's,
Yeah, yeah, yeah.
it's just a
Yes,
squirt.
yeah.
The one container, you sort of load it and it squirts half in one nostril.
Mm-hmm.
You load it again and it squirts the other half in the other nostril. So it's a very easy application. Can be
Provided they
given with
don't
any
sneeze.
vaccine. Yeah, provided you don't. But even
Seems
then,
quite ageist, though.
but
I have to
I
say.
know. Maybe it is quite because it's a live attenuated. So the immunocompromised, the
Right,
pregnant women,
yeah.
it's that. So you want to give it to. In some countries, interestingly, the upper limit goes up to 59, but the UAE has made it 49,
that's
and I don't know
interesting.
the exact reasons. But maybe because it's the first time we have it here, I don't know. But in some
Okay.
countries, in Canada, it's up to 59 in some countries. So not so ageist. So you could have,
Going back to the audience
Yeah.
member's question again,
Yeah.
or say it's me.
Yeah.
And is it safe to have it done twice a year, or should we literally just be having it once a year?
It is safe to have it done
is
twice a
safe
year.
to-
So to
if
be
we want that extra protection.
The one thing I find myself repeating all the time, and this applies to any vaccine, you cannot hyper-immunize. You cannot hyper-vaccinate. So people
Okay.
worry so much, what if I'm not sure my child had the second dose of XYZ?
Right.
But I need proof that I've had it. And unfortunately, we still live at a time where unless you've got proof that a
Yes.
vaccine's been given, it
Yes.
hasn't been
Yes.
given,
Yeah.
you can go and do an invasive, more expensive blood test to check for your immunity against that disease to prove
Yeah.
you've got immunity, and that
Yeah.
sometimes is enough proof that you don't need a second dose. So you cannot hyperimmunize, but is there a need? Timed properly, if you do have your flu vaccine at the beginning of the season, the season should ideally not
Yeah.
be problematic beyond March, April,
Yeah.
and then you get it again in September, October the following year. So there's no need to have it twice, but you could have it twice.
Okay.
Okay. Fascinating. Right. I'm going to bring you in again. Thank you so much for your questions. But again, we're going to get you involved in the poll again for us. So we just want your crowd wisdom on this one. What's your biggest challenge staying healthy during flu season? Is it remembering to get vaccinated? Will be interesting to see how many of you say that. This is going to, I feel this will be a popular choice. Managing children's exposure, school, friends, play dates, maintaining healthy routines, sleep, diet, hydration. I want to come back on them. And then something that I'm very, very keen to come on to, balancing stress and mental health, because I want to talk to you about the impact of that. So please vote now. What do you think is your biggest challenge out of those? Remembering to get vaccinated, managing your children's exposure, maintaining healthy routines, or balancing stress and mental health? I feel like we should have a fifth option, which was all of the above. But again, which do you? I mean, I guess out of all of those, I think number 2 would probably
2 and the
as
last
a parent,
and the last one.
and the last one.
I would say
2 and the last one.
I would say 2 and the last one as well.
Yeah.
Okay.
And I feel that the balancing stress and mental health goes across all aspects.
Well, I'm going to find out how people have voted, and then obviously
Yes.
as a founder of a platform
Yeah.
that talks about mental health, I
Yes.
really want to have a little
Yes.
conversation with you about that. So let's see how you voted. Okay, so well there we go. Actually, and this is an interesting comment on our lifestyles these days. Managing healthy routines. Biggest answer so far, nearly 62%. So nearly 2/3 of people just maintaining their healthy routine. So maybe we've got more non-parents than parents on the call. But then fully 1/3 managing children's exposure and school friends. And only 5% balancing stress and mental health. So
I think if you had you had multiple answers, you would have had many of those actually ticking that box
I
as
think
well.
in one way also perhaps the link between the healthy routines and balancing stress and mental health. Because sometimes people don't actually see the connection.
Yes, absolutely.
And we're still in this
I
kind
agree.
of period of education around that. It's one of the things we work together to
Yeah.
try and do. So we've answered that. Let me ask you that specifically then. Like, how does stress or mental health affect our immunity? You know, can being run down emotionally burnt out even make us more vulnerable to
Absolutely.
physical conditions such as influenza.
No, absolutely. So the link is through several aspects, but cortisol. So when you're stressed, it increases cortisol, which is a hormone that the body produces under stress. Sleeplessness also increases your cortisol levels. So when you're stressed, you sleep less because you're worried about it. You probably eat worse. So again, that also then affects how many of those immune boosting dietary components are in your body, and even when you do sleep, your sleep quality isn't so good. So you're not getting enough of that, deep sleep, which is when your brain is actually cleaning up lots of the byproducts of all your thoughts, etc. So there is a direct connection, and we see it. So it's funny. I see more teenagers in my office with illnesses in the run-up to exams than I do in the beginning of a school year when I see more infants and new nursery goers being exposed to the viruses.
Right. And you've literally just stolen my thunder, because that was going to be a follow-up. No. Absolutely brilliant. I was like, do you actually see this in children? Like stress at school, anxiety, the exam thing, that affects them. They're more...
Yeah. Affects their focus, affects their class performance, which then in return they start getting feedback that's fairly negative coming from their teachers or their parents. So then that also reflects negatively on them while they're going through a time where they're still trying to find their identity and build their personality, and anything shakes their confidence. As confident as they look to you, they go in on themselves. They start and they adopt their sleeping less anyway. Even when they go into their rooms, they're probably staying up way beyond what you can imagine, and then lots of them do the sports. So then they have their early training, their the after school trainings, the clubs, and then the going out with friends. We're so lucky we live in a place where it's so safe for our children to actually go out and do things. So our children do tend to actually do more because it's safe for them and easy for them to do so. So all of that, it all adds up. And yes, I do see it a lot. I was looking at this the other day, and I'd love to do a study on it. I tend to refer more children, and I would say tweens and teens, for mental health support in the sort of second half of the school year than ever, So, and they don't ever come into my office now, hardly see. So the bulk of our work is sort of maybe the under 7s and 8s. And then I tend to see the other ones later. They come to my colleague who's an orthopedic surgeon with their sports injuries, the older ones, but they tend to come into my office with the sore throats and the recurrent sore throats, the recurrent headaches. And some of them are psychosomatic. Some of them, there isn't actually a clinical sign. It's almost actually, you can tell this child is so stressed, but their brain's telling them that a part of their bodies so well.
Almost like cortisol kicking in again, as well as an inflammatory. And if we talk about adults then, again, I mean, are you seeing more of this? How often are you seeing sort of stress and mental health issues exacerbating that vulnerability to something like influenza?
So a lot more. And I would say this is something that we truly have COVID to thank for in a good way.
Okay.
So I think the pandemic did highlight mental illness in a way that it made it so much less less a taboo. So people now very much, so many more people will sort of say that, a mental illness is the same as a physical illness. And it truly is, because many of them are biochemically based, and many of them are, doesn't mean you have to treat them with medication. It's just the way you work through different therapies does help you then heal. So more and more people do come through with what they can now pinpoint as mental health symptoms. And maybe mixed in with some physical symptoms. And it's chicken and egg. If it's neck pain with the sort of headaches and stuff, and that then giving someone a feeling that they can't complete a task, or it's so painful to, and then bordering on symptoms of depression. So you don't know which started which, but essentially more people come seeking support.
And on a surface level, because obviously there is a distinction between mental illness and someone that's struggling with their mental health in terms of they're exposed to long periods of stress at work or something like that. How much is that? And we know that once somebody starts struggling with their mental health, that can tip them down into struggling with and having to live with mental illness. So how much is it really important for people to get a grip of that that stress. So when their mental health is challenged.
Yeah, hugely important, and it's far easier said than done. I mean, so many of us have jobs where you don't own your schedule. You can't sort of cut your hours down, or you can't. So I think having insights and being able to step back and think, what is it that would make me feel better? So, yes, get your sleep. Yes, eat well. But is there a hobby you can take up? Is there maybe something where you've got groups of people you interact with? Is there, even support groups, even when it's one-way information, like going online and actually reading other people's stories. The idea is don't hide away from it, address it, have the insight, because you're absolutely right. If you ignore it long enough, even the strongest person hits a brick wall, and the results might be so much more disastrous. So disastrous, I don't want to say much more disastrous, but so much more complicated than the simple aspect of going to your general practitioner, going to your family doctor to have this conversation and try and see what coping strategies that maybe not directly mental health support, just coping strategies could be woven in, to your into your lifestyle to help cope with that or reduce the risks.
Comes back to the audience, though, didn't they? They said struggling with their lifestyle.
Yeah, I think also it's down to the individual, because I've seen instances where everything is presented, but then there's this inertia, and they feel like they're not willing or ready, willing enough or ready enough to go and have that conversation and to visit their family medicine practitioner and stuff. So I think there's a lot of components, a lot of moving parts to this. Yeah.
And people tend to like to box something and be able to put their finger on it.
Yes.
So it's far easier for someone to say, I've had recurrent headaches or I have recurrent abdominal pain, because they truly believe their brain isn't, because it feels like such a weakness, or you're holding things together because your life's so difficult and you're so responsible, giving in to that possibility that your mental health is suffering, stops you from being able to be in control. So I think this is where the message would go out to doctors, physicians who receive these people in their offices, and many of us don't have the luxury of time, but to always think, to always ask the questions, to always tease these out, to then give someone a safe space to even realize that they're there with an issue that goes beyond that immediate physical symptom.
Yeah.
I mean, again, coming back to what you were saying there, which I 1,000,000% agree, which is, and we often say at Mental, all health is mental health, and vice versa.
Absolutely.
And that whole idea of listening to your body, is it actually sometimes even influenza? If we go back to what the audience is saying, nearly 2/3 of people on this webinar saying they're struggling with their lifestyle. Sometimes is influenza sometimes a red flag for other things? It's not just that I've contracted a physical virus. It's, the prevention being much better than the cure.
Yeah, it can be. So if you are the only one amongst your social group, whether it's at work or socially, who caught influenza, although other people supposedly share the same lifestyle, why is that?
Right.
Provided you're previously a healthy individual with no autoimmunity or immunocompromise, why is it that you are the one who falls ill more often? Why are you the one who catches things off your children when others don't? Why is it you and not your wife? Or not your husband, So those questions should then give rise. What is it? What is different about me? Am I eating right? Am I sleeping right? But is there something going on? Are my stress levels higher? So yes, I would say that not just catching influenza on the get-go, but if you catch influenza every season, why is that?
Right.
And then maybe look into things that you can be doing, perhaps, to reduce the risk of that.
I feel it's challenging if it is with teenagers, because I know as a mother of a teenager, he is very, very reluctant to have that conversation. I know that you said that there have been instances where you have recommended and suggested that they speak to someone. But it's how would you kind of counteract that?
Yeah, it's very difficult.
Yeah.
And I think if a parent succeeds into getting their teenager into a pediatrician's office with a physical symptom, because it's far easier to say he complains of headaches all the time, or she complains of abdominal pain. It's usually headaches, abdominal pain are two of the most common psychosomatic symptoms we tend to get. Very commonly.
As an indicator
of more of a mental health issue rather than an immediate anxiety, stress, exactly, exam stress, social stresses, peer pressures,
social media,
maybe bullying, social, exactly. So all those things, complete other many episodes, and not this one. You can't even fit them in.
If you want to stay tuned for another 5 hours,
we're happy to stay. Yeah, but so if a parent does believe there is something there and they're struggling, because I'm a mum of 2 teenagers, and yes, I'm a pediatrician, but they struggle to talk to you directly. If you are to get them into a doctor's office, it sometimes does give them the space, because they're able to, again, it's like the parent, it's like the adult who can put their finger on something. You can then blame something, and you can, and down to the physician again. So while I'm examining this teenager, burly, big teenagers who's a little bit put off by the fact that they have a female pediatrician. But I do get that. And I've known them for years. I've had patients for like 15 years. And then while I'm examining them, yes, your throat does look red. So what time are you going to bed these days? So what activities are you doing? Do you have exams? So it is that personal approach. And once you get going there, do you find, do you find it stressful? Would you say, would you have headache? Do you think you're drinking enough water, because that can give you a headache? So trying to get them, and they're very, very much monosyllable answers.
Yes,
but then actually saying, do you know what? And I sometimes will step back and say, do you know what? Our brain is like any other organ in our body, and there are people who are emotionally disconnected from you, and it's a private conversation, and they might help you organize your thoughts. And sometimes, would you like to try that? It can be online, it can be in person, and I just like, and I was like, but it's funny with teenagers nowadays. It's less of a taboo. It's almost something they're proud of sometimes. It's almost something they go back and say, I've seen my therapist, because there is schools are doing such a good job raising awareness about how teenage stress, leading to teenage mental health issues is definitely a thing. It's definitely something to note. So it's not as difficult as it used to be, I have to say.
It's because the impact is so tangible.
Yeah.
Like you're able to see, the number of days that you are taken off, their performance within their academia. Yes.
But that is all tracked more than when we were growing up, all of a sudden when I was growing up.
Yeah,
when
absolutely.
The world was in black and white as opposed to in full multicolour.
No, very multicolour, But absolutely. And many of them actually like that, as it gives them a way out, both in their brains and also to their parents and to their peers, a reason why they haven't had the best exam scores, a reason why they didn't make the A squad in rugby, a reason why. It almost helps give an excuse rather than it was bad behavior. So there's something there. If you tap into that and sort of open that up, then you can help lots and lots of children.
We're talking about, our children and the fact they've got access to so many different activities and all that kind of thing. If we look at our lives here, in this region, what are the kind of practical advices? Because there'll be many people on this webinar that drink like me, that drink too much coffee. There will be smokers. There will be vapors. There will be people that go to the brunches and consume.
Absolutely.
So what are the things that are the no-nos that they should avoid, or what are the things they should introduce into their lives to help boost their immunity and thus keep them safer, healthier this flu season?
So as a person and as a doctor, I'm a big believer that moderation is key. So I think this concept of absolutely avoid, there are the obvious, let's say, illegal substances that should obviously be avoided. Let's not mention them, obviously. So that goes without saying. But I think when it comes to, something like smoking, of course, I think there is no there is no question that nicotine is bad for your health, that all the other components that go into vapes and cigarettes and cigars, what have you, I don't think anyone can say that's good for my health. Some people will say that's good for my mental health, which is where you then step in and say, maybe we can find something else to replace that, because we know it's horrible, and I'm not going to go into, we all know. And then you have things like you mentioned, brunches and drinking, so alcohol drinking, etc. There's now even rising evidence that where people would say, for those people able to drink, people would say that, let's say, red wine was actually good for your cardiovascular health, but there is rising evidence that any little bit of alcohol is actually bad for your brain, for your brain cells, and bad for your body. So it's very similar there, So I would say moderate, minimize minimize the things that we know are bad for us. Increase physical activity. The trend now, which is a very good trend, which I've also jumped on the bandwagon with, is increase for adults especially, increase look at your muscle health,
Yes.
increase your protein intake,
Yes.
and the longevity is directly linked with actually muscle mass and your ability to squat and your ability to actually have a good grip strength.
Yes.
And there's so much evidence there. So it's away from all the cardio exercise, which is fun, but actually looking at that. So healthy lifestyle, looking at maybe more of a paleo diet that looks at food coming from natural resources, occasionally dipping into the easier things to people say, is it okay to do protein shakes? Is it creatine? We can't always have the best fillet of fish or the piece of steak during our workday. So be reasonable, sleeping well, staying well hydrated. They are basics. So if you have a lifestyle which pushes you in a situation where you do have to expose yourself to the things we know are bad for us, balancing them out. It is all about balance. We forget our bodies are excellent filters. So that little bit of substance people worry about in a vaccine, or the toxic metals that we might breathe in crossing the road, or the things things in food that we microplastics, etc. Our bodies are good filters. So as long as those are minimized as much as possible, you can live a healthy life. It's not the end of the world. So I think don't get so stressed about doing it perfectly, but be aware.
Don't let perfect be the enemy of good.
Absolutely. Yes, exactly. Good is better than best. My husband always says that to me because I always want perfection. Good is better than best.
Touching on what you said about moderation, I know that there was this huge focus on the Blue Zone diet and really looking at elements that, and some people drank in moderation or ate full, like fatty
and lived to
foods,
being 100 years. Absolutely.
And it's that moderation of your mental well-being, that sense of community.
Yes. And that was the biggest factor, the sense of community, the sharing of, the emotional support that happens. Absolutely.
Which you can't buy in a bottle as a supplement of vitamin C. So community also incredibly important. One final quick question from the audience member. Again, Minu, thank you. And which is another one coming back to parenting. Kids obviously eating a lot of fast food these days, even if parents are trying to do that. What are the best things to be included to counter this, to boost the at that age? What can we make sure is in their diet?
So fresh fruits and vegetables, high in antioxidants, and to try and 80-20 rule. 80% of the time, try and eat healthy. 20% of the time, we all love treats. And I think that is a language your children can understand as well. So rather than saying we're not going to go to the Golden Arches today and get you your Happy Meal, we'll save that for the weekend, let's say, things like that. And I think children do respond well to that. And trying to find alternatives that you can make at home or even order in or purchase that are good, healthy alternatives. A burger is a healthy meal if made in a healthy way. Actually, it's got all the... Absolutely. So in essence, and sometimes showing them something, like the very, now it's become a cliche, showing children how many teaspoons of sugar are actually in that sugary drink, and actually weighing it out and showing them literally. When you visualize it, it is scary for them to see, or showing them how much caffeine are in those energy drinks, for the older ones who just want to grab their energy drinks, which, I would love to be banned at some stage, the ones with the high, they have sort of seven sort of, 7 cans of Coke or 3 cups of coffee in some of them. It's crazy. So I think making it visible for your children, and even the younger ones do understand quantities, and also not stressing out when there is that birthday party with that cake full of coloured fondant and that,
Coming back to the filter aspect.
Yes, absolutely.
Right.
Yeah.
If you could give our listeners, viewers, one thing they could do tomorrow, what is the one thing you would do?
One thing. Oh, it's tough getting one thing out of me.
Absolutely, yeah.
Influenza vaccine.
The vaccine.
Influenza vaccine.
Oh, the vaccine.
Yeah.
All right, second one.
Basic principles, sleep.
Basic principles, sleep.
Yeah, sleep, diet. So to me, those, absolutely.
You have to have that nourishment.
Yeah. And maybe I would say sleep, diet equal, and maybe even slightly ahead of the vaccine. But if I had to say one, because I know what hospitalizations are like and days off school are like, and so
absolutely.
I could genuinely talk about this
Forever.
for
I know, me
hours.
too.
Yeah, it's been a brilliant conversation.
Yeah.
Thank you. Just to recap on some of the advice. So again, vaccines, basic principles with your kids in particular, 20/80 rules. Try not to stress too much, but also focus on. And again, you guys kind of know what you need to do because again, managing healthy routines, just focus on. So maybe the fact you've answered that question, have a little look at your routine again and see what changes you can make to that. But Dr. Rania, thank you so much for joining us
Oh
on
my
the
God, thank you.
podcast
This was
today. It's been a great
pleasure.
conversation.
Thank you.
And of course, as always, thank you for joining us at Connect for Health today. Thank you for all your questions. Thank you for voting in our poll. Again, reminder to those catching up on YouTube or indeed on the podcast channels, if you want to take part in the podcast and ask your questions, reach out to Cigna Healthcare for details of membership. While you're there, don't forget to check out previous episodes as well. We've got some crackers. One's about the benefits of mobility, children's mental health, digital addiction. So go back and catch up on some of those episodes because they really are worth watching. And also, once the webinar comes to a close, we will ask you for your feedback. Please give it us because it helps us help you and we can just refine these webinars so they're super useful for you. So once again, from Connect for Health and everyone here, thank you so much for joining us.
Thank
Goodbye.
you.
See you next month.